research at the University of Kentucky, and who is probably the nation's foremost expert on food insecurity and its impacts on the American population. So without too much further introduction, I'm going to turn you over to Jim.
Thank you so much. It's a pleasure to be with you today, and I'm going to find my presentation. There we are. Great. So I'm going to talk to you today about food hardships and food assistance before and during the COVID-19 pandemic. In particular, what I'm going to do is go all the way back to 2001, which was a recessionary period for those of you who can remember. And but importantly for me, we're going to start in 2001 because that's when the data for food insecurity in the United States started to be collected consistently in the month of December as part of the monthly supplement to the current population survey. So I'm going to use data from 2001 through 2019 from the current population survey, and then I'm going to pull the data forward into 2020 and into early 2021 using the Census Bureau's Household Pulse Survey. The analysis primarily will be focused on adults ages 18 and over, as well as seniors ages 60 and over. Part of this, as I'll explain momentarily, is being driven by the sample frame of the Household Pulse Survey, not by the CPS. I'll show you trends in food hardship overall, as well as separated by low-income households and by race. The work that I'm going to talk about builds on a paper that was published in the fall in Applied Economic Perspectives and Policy. Then I want to do is turn our attention to its discussion on the federal food policy response to this hardship. And in particular, I'll focus on the Supplemental Nutrition Assistance Program, or SNAP, which is sometimes referred to as the food stamp program. I'll talk about expansions in SNAP during the first decade of the 21st century. I'll talk about the COVID-19 response, and then I'll talk about some current discussion by the Biden administration to kind of fundamentally restructure the way the SNAP benefit is constructed, okay? Okay, so what I'm gonna begin is just give you a brief overview of how we measure food hardship in the United States. Now, the standard measure is food insecurity. Now, what is food insecurity? This is a condition in which households lack access to adequate food because of limited resources. And the way that we measure this is through a series of questions called the Household Food Security Module. And since 2001, this has been documented in the December supplement of the CPS, as I mentioned a moment ago. And households face a series of 10 questions asking about their food security status, or 18 questions if there is a child under age 18 in the household. Okay, so households with children get 18 questions, households without children get 10 questions, and those extra 8 questions are kind of child-focused questions. USDA classifies a household as food insecure if they respond in the affirmative to at least 3 of those questions, and then they're classified as very low food secure if they respond in the affirmative to at least 6 of the 10 questions, if they have 10 questions, or 8 of the 18 questions if there are children present in the household, okay? So each September, the USDA releases its annual report on the food security status of households. So it won't be until September of this year that we get the official statistics pertaining to the 2020, the pandemic year. And so that's why our sample from the CPS ends in 2019, because it was the December 2019 survey is the most recently available for public access at this point in time. Now, I'm using the word food hardship because I'm going to talk about 2 additional measures. But I wanted to isolate the food insecurity because this is the most prevalent measure that's used in the United States when we talk about the food status of households. So just to give you an idea of what this looks like in terms of trends, now this is data from the CPS. These are weighted estimates up to the population of the US. This is all individuals of all ages. So I mentioned previously, I'm gonna be focusing on those 18 and above. That's, again, because of the household pulse survey. This is all persons, okay, regardless of age. The top line shows the fraction who are food insecure of the US population. The dashed line shows the fraction who are very low food secure. And so in a typical year from 2001 to 2007, about 11 to 12% of the population were classified as food insecure. And then there was a pretty substantial 30% increase with the onset of the Great Recession in 2007. So this big spike up here in 2007, that's the onset of the Great Recession. And you can see that it remained elevated for years. Okay, officially the National Bureau of Economic Research declared the formal end of the Great Recession right here in 2009, right? But you can see that food insecurity remained elevated for several years afterwards. And it really wasn't until after 2013 that you started to see a significant decline in food insecurity. And by the way, if you looked at poverty rates, you know, the official poverty rate in America, it followed a fairly similar trajectory, right? That it took a long time for poverty really to start turning down. And so, you know, the last few years, you know, after 2014 were actually very strong years for people in the bottom half of the income distribution. You know, it took them about a decade to kind of pull out of the Great Recession. And unfortunately, this is, you know, leading right up before the COVID-19 pandemic. Now, importantly, though, on the eve of the pandemic, you could see that the rate of food insecurity was actually lower than what it had been even back in 2001. So it not only recovered, but it more than recovered. Okay, so we were clearly on a positive trajectory prior to the pandemic. Now, in terms of very low food insecurity, now this is obviously a much more serious condition facing households. And so sometimes people refer to this as the, you know, fraction of people facing hunger. Okay, so sometimes euphemistically we'll call food insecurity the fraction of the population at risk of hunger, and those who are very low food secure as facing hunger. And now we don't officially use the word hunger because this is, physicians like to characterize hunger as a physiological condition, right? And so this is not based on physiological biomedical measures, right, of malnutrition. This is a measure of food hardship due to financial constraints, okay? And it's a household level measure, although, you know, basically weighted up to the individuals. Okay, now, so that's where we were on food insecurity leading up to COVID-19. There's an alternative measure of food hardship that I'm going to talk to you about now, and that's called food insufficiency, and I'll describe to you in detail how we measure that in the next slide. And the reason that I'm going to turn attention is what I already mentioned, is that the 2020 food insecurity won't be released until September of this year. However, we want to be able to inform policy of what's going on during this terrible health pandemic, right? This is one of the challenges the United States faces, and many of our household surveys are released with significant lag, okay? And so for the typical survey like the CPS, we don't get as much real-time information on hardships as one would like to have to inform policymakers during an event like COVID-19. Well, Census Bureau, in collaboration with 4 other federal statistical agencies, actually did respond to the pandemic, and they established what's called the Census Household Pulse Survey. The Pulse Survey differs importantly from the CPS in the following ways. One, the sample frame is adults 18 and over, okay, first of all. Second, it's a web-based survey, and it's a web-based survey that was conducted weekly. in 3 phases starting in April of 2020. The CPS is either in person or by phone, okay? So there are some design differences, and I'll tell you a little bit about that when we look at some of the estimates in a moment. In addition, they don't ask the 18 battery questions on food insecurity. Instead, what they ask is this summative question on food insufficiency. Part of the reason they did that is that this survey was sponsored not only by Census, but Bureau of Labor Statistics, the National Center for Health Statistics, Department of Ed, and each of these federal agencies wanted to get a subset of questions on the survey in order to minimize as much as possible respondent burden. You know, each agency only got a limited number of questions that they could include onto the pulse survey, okay? So we have this measure of food insufficiency. So this is a broad measure of food distress. And in fact, this measure of food insufficiency is a screener for eligibility for the 18 questions that are asked on the CPS. Specifically, what the Census Bureau does in December with the food insecurity module is that they ask a broad measure of household income. And if your household income is below 185% of the poverty line, then you are automatically asked the 18 questions in the household food security module. But then they ask everybody else in the sample, the CPS, whether or not they face this condition of food insufficiency. And if they answer yes to this question and one other question of food hardship, then they also get thrown into the food security, 18-item food security module, okay? So what is this question on food insufficiency? It's stated as follows. Which of these statements best describes the food eaten in your household? Enough of the kinds of food we want to eat, enough but not always the kinds of food we want to eat, sometimes not enough to eat, or often not enough to eat. And so a household is classified as food insufficient if they answer, wrong button. If they answer number 3 or number 4, sometimes or often not having enough food, okay? So if they answer 3 or answer 4, then we classify the household as food insufficient. Now, there's an alternative measure that we call food insufficiency with reduced variety, and that would be if you answer 2, 3, or 4, okay? So what is 2? 2 says you get enough food, but not enough variety of food, okay? And I'll come to this in a moment when we look at the figures, okay? So that's how we're gonna measure food insufficiency. And again, the advantage of this measure is that we're gonna be able to measure it for the entire period from 2001 all the way up into the second week of March of this year, okay? So we're getting a nice long time series. Okay, so here's the graph. On the left panel, we've got all incomes. Again, the population is 18 and older, okay? And that's in the solid black line. The red dashed line are ages 60 and older, okay? Now, why do I pick out 60 and older? Well, in part because I've written a series of papers over the last dozen years on food hardships facing older Americans. And so it's a population that has tended to be understudied in terms of food hardships. And so myself with my collaborator, Craig Gunnarsson at the University of Illinois, have written a series of papers sponsored by Meals on Wheels Association of America, more recent, and the National Foundation to End Senior Hunger, and more recently by Feeding America. We write an annual report on the food security status of older Americans. So that's part of the reason why I pull out this population, because they're of special interest to me, and of course, I think to many policymakers as well. So notice the dating on the x-axis, right? So I'm just highlighting select dates. 2001 is when the period starts. I highlight 2007 to 2009. That's the official dating of the Great Recession. Then I highlight 2019, which is the last observation we have for the current population survey. And then I've got 4-20, that's 1 week in April 2020. I've got July of 2020, December of 2020, and then March of 2021. And there are more dates between between April and March in that year. There are more observations. I'm picking out basically every third week of the household pulse survey. But just so that the axes aren't too crowded, I'm just selecting out specific dates. So what do you see in the graph? Well, if you look at on the left panel, again, this is all incomes, you can see that there's a massive increase in food insufficiency with the onset of the COVID-19 pandemic. Okay, then this massive increase is most prominent amongst those 18 to 59 years of age, because you see an increase, but it's not as dramatic amongst those 60 and over, okay? Now, what can explain some of this? Well, remember, there are mode effects. This is a web-based survey here in the COVID period, as opposed to phone or face-to-face. Now, Pat, of course, is an expert at surveys. There can be mode effects, but rarely would you expect mode effects of that magnitude, okay? I have looked carefully at the demographic composition of the two surveys, and they actually align quite well, okay? So if you think about, are there observable differences in the population of people responding to the COVID survey versus to the pulse survey versus people in the typical December CPS, the answer is no. There aren't dramatic differences on the usual demographic characteristics: incomes, education, race, family structure, things like that. So they seem to align quite closely. We won't really know, until September, whether or not the CPS also reports a big spike like this. Okay, but we're demonstrating this huge increase in food hardship in the United States. Now, if we restrict attention to those households with incomes less than $50,000, you can see it's a giant increase from about 8% in 2019 to about 25% in the summer of 2020. Okay, so it's clear that this pandemic was particularly hard on low-income households, and you also see a much bigger increase in the population over age 60. Now, you do also see some glimmer of hope, right? So you do see some reduction finally after Christmas, right? We had this big spike in COVID right towards the end of the fall or into the Christmas season, and so you can see some recovery here. Now, if we expand the definition to include that third outcome, okay, remember I said food insufficiency with reduced variety are those individuals that respond yes to either 2, 3, or 4. Basically, the pattern looks the same, it's just a shift upward, okay? So before the pandemic, in a typical year, it was between 20 and 30% of the population 18 and over who had food insufficiency with reduced variety. And that increased to about 45% during the pandemic, okay? Now, what's kind of interesting here is that when you focus on the 60 and above population, you do now see this big spike, okay, in food insufficiency with reduced variety. This, of course, is perfectly consistent with the shelter-in-place policies that were enacted in March and April of last year, right? So we had the shelter-in-place orders. So, seniors were getting some food, but they weren't getting the varieties of food that they were getting pre-pandemic, okay? Now, what about when we look at issues of race? So here I've just separated by persons who are white versus persons who are Black. And you can see that the risk of food insufficiency is at least double to triple amongst African Americans compared to white Americans, okay, in the survey. And this is true both for 18 above as well as over 60. Now, what's kind of interesting, and I haven't been able to delve deeply into this, and time will tell as more weeks of the pulse get released. But we are observing this massive decline in food insufficiency amongst Black seniors over the age of 60. Now, is that real, or is that some kind of, statistical fluke? We don't know. But it does seem to be occurring to less of extent amongst white seniors. But you did see it overall here, in this one. We did see a downturn, as I pointed to before. So especially a downturn that was strong amongst households with incomes less than $50,000. So maybe this is a reflection of some of the stimulus, CARES 1 and CARES 2, the different stimulus packages that are going out to these households. That's entirely possible. Okay, now the third measure of food hardship, and I want to be mindful of my time here, that I realize I should try to wrap up in the next 5 minutes or so. You think?
Yep, that would be good.
Yep. Okay, great. Okay, so an alternative measure is just what fraction of the population are receiving charitable food? And what do I mean by that? Well, that would be people going to a soup kitchen, going to a congregate meal center, like a senior center, having home delivered meals like Meals on Wheels, or some assistance from a food pantry or bank. Okay, now the CPS asks about receipt of such food in the prior 30 days, but only amongst the low income population, those with incomes below 185% of the poverty line, or who report being food insufficient. The poll asks whether or not anyone in the household gets free food in the prior 7 days. So what I'm going to do is focus this analysis in both the CPS and the Pulse to low income and or food insufficient population. Okay, so the statistics aren't representative of the entire US population, just the low income or food insufficient. Okay, so the black line is people 18 and over, right, receiving any charitable food. And then the red line are persons ages 60 and above. So first of all, you can see a big gap between seniors and the adult population overall. And this, of course, is consistent with senior participation in congregate meal centers, home delivered meals with Meals on Wheels, things like that. One thing you should pick up, though, is that notice there was a pretty strong trend increase in the fraction of adults 18 and over getting charitable food. Even in the decade prior to the pandemic. But then you saw two really divergent paths with the pandemic. Amongst 18 and above, you saw this big increase in receipt of charitable food, but amongst seniors, you initially saw this huge retrenchment in charitable food. Again, this is perfectly consistent with shutting down of senior centers and things like that occurred in the early days of the COVID pandemic. And then as time went on, these senior centers started to reopen, right? And so that's why we see this increase in the share receiving charitable food. Okay, so again, this other measure of food hardship, really clear that the pandemic has been a huge shock, okay, for many families. Okay, so let me talk in the last few minutes on the federal, I'm gonna focus strictly on SNAP, okay, the SNAP program. And we can maybe in the Q&A, we can talk about some of these other programs, okay? But, briefly, what is SNAP? SNAP is a federal in-kind assistance program operated by the USDA. The benefits can be used to purchase food for home consumption. You can't use it to buy alcohol, tobacco, or hot prepared foods for immediate consumption. The program was initially proposed by President Kennedy, signed into law by President Johnson with the Food Stamp Act of 1964, and in 2008, it was renamed as SNAP. Okay. Eligibility is unique in the safety net because it's not conditioned on work in general. There's a small group of people who have work requirements. It's not conditioned on family structure, so a lot of welfare requires children to be present, and there's no restrictions based on age. You do have to have low income. There are 2 income tests, and you have to have low assets. So there are 2 different asset tests. There are special rules for 60 and over population, disabled, as well as participants in the welfare program TANF or the disability program SSI. Okay. Benefits are delivered by an electronic benefit transfer card, the EBT. There's about 250,000 outlets nationwide where you can redeem SNAP benefits. The benefits are set federally and they're the same across the lower 48 states and DC. They do vary by household size and they're adjusted upward for people in Alaska and Hawaii. The amount is based on the Thrifty Food Plan, which I'll tell you about in a second. And the minimum benefit is $15 in the 2019 fiscal year, and it was $640 per month for the maximum benefit for a 4-person unit. Okay, so I want to tee this up for part of our discussion in the remaining time today, right? Which is, how is SNAP constructed? Is SNAP constructed? There's a maximum benefit that you're eligible for based on the number of people in your household, and then they subtract away 30% of what your net income is. Okay, so the benefit is supposed to be a supplement. You're supposed to be able to provide 30% of your food budget, but if your net income is 0, that means you qualify for the maximum benefit. Okay, so before the pandemic, about 40% of people on SNAP got the maximum benefit. Okay, what did CARES 1 do? The first CARES Act raised everybody who is below the maximum up to the max. Okay, so that was a huge increase. That meant 60% of people got lifted up to the max. Then CARES 2 temporarily raised the maximum benefit by 15%. And then the American Rescue Plan extended that 15% increase in the maximum benefit until the end of September of this year. Now, more importantly, so I mentioned the TFP. The TFP is the Thrifty Food Plan. That's what's used in constructing the maximum benefit. The administration is currently re-examining whether or not they should change the way the Thrifty Food Plan is constructed. I wrote a policy proposal 5 years ago for the Hamilton Project, which is part of the Brookings Institution, where I proposed a 20% increase in the TFP for all family sizes to account for the fact that the way the Thrifty Food Plan is constructed is that they assume that time is costless. Time doesn't, your time is free to produce food, right? And it also makes really unreasonable assumptions about how much time, a typical family would spend in food production. The average for a 4-person family would be about 2 hours a day in meal production. Okay, and there is no American family that spends 2 hours a day in meal preparation. So the TFP is outdated and it needs to be updated. And the administration is currently looking at that as a path forward for the SNAP program. And that would be the biggest change to SNAP since the 1977 Food Stamp Act. Okay, so it's kind of a big deal. And I will stop there.
Thanks so much, Jim. That was really interesting. One point I wanted to clarify is that the numbers that you showed us for food insecurity include the effects of the increase under the CARES 1 and CARES 2 Acts. So in other words, that huge spike that you showed us is even taking into account the fact that we were working to counteract that food insecurity. Is that right?
That is correct. Absolutely. That is correct. And so, what did the CARES 1, involve? Well, there was the $1,200 direct payment for adults, $500 per dependent, through CARES 1, a huge increase in unemployment insurance. So unemployment insurance for those people who received unemployment insurance, they were then eligible for an additional $600 payment from the federal government. And importantly, on top of that, they received the expanded eligibility. So traditionally, people in the gig economy, self-employed, so Uber drivers, those types of people weren't eligible for UI, and they were all made eligible. Okay, so you did have both an increase in unemployment insurance, increase in who's eligible, plus these direct payments from the federal government. And yet we still saw this massive spike in food hardship. That's correct.
And in fact, we also had an increase, as you mentioned, in the amount of the benefits available under SNAP. So
correct.
So it's kind of, it's very telling that we managed to increase our food insecurity in spite of all of this.
Correct. Yeah.
Do you see a big difference in the kinds of people who became food insecure during the pandemic compared to the types of people who were likely to be food insecure before that?
That's a great question, and there is a slight change in risk factors, and so people, younger adults were at greater risk of food insecurity during the food hardship during the pandemic than what we saw pre-pandemic, and and part of this is because of the lockdown, right? And so that population, I think, became at much greater risk than what we saw pre-pandemic. And so that would be the big change. But other than that, it did, because that's part of the reason why I wanted to show for low income households as well as households overall. And so you do see a big increase in households in general, and as well as low income, as well as by race, right? And so it did, there are definitely certain populations affected by COVID more directly, right? Frontline workers working in the hospitality sector who are affected, by layoff, but also the health risk of certain populations. African Americans, Latinx populations seem to be at greater health risk for some of the health consequences of COVID as well.
Mm-hmm. Maybe just chime in here with another question, for which there may not be an answer, which is that, and as part of the pandemic, obviously, was a shock to people's incomes, but another thing that happened, which clearly shows up in the data in the respect of seniors who were eating in senior centers, as it was a disruption of the normal patterns of supply. I mean, just in terms of, if not in terms of whether there was actually food in the stores, although early on that was a concern, the question of getting access to the stores, being able to wait in the lines in order to observe social distancing and so forth. And I'm wondering if there's any effort or any ability here to sort out which of those demand side or supply side factors is at work in some of this data.
Yeah, it's a good question. I mean, I'll be honest, it's not something that I've looked into yet, but it's on the agenda. What's kind of neat about what's happened with COVID is that there have been a lot of other new data collection endeavors. And so Johns Hopkins and other organizations have collected a lot of data on policy measures enacted at the state and sub-state level in terms of, shutdown of different operations. And so, one in theory could leverage the kind of the cross-state over the COVID period, so cross-state over time, implementation of different measures that shut down. One of the things, I haven't looked at, so for example, we know some states in the upper plains, right, didn't shut down economically in the way that some other states did, and so where there are increases in food hardship is great in those states compared to others. And honestly, I just haven't looked at the kind of the subnational level in my analyses.
It would be hard to do that in the pulse survey, wouldn't it?
What's that?
It would be hard to use the pulse survey for that, wouldn't it? Given that it's not that large.
Oh, it's 70-some thousand individuals in a typical week, I think. So it's pretty big. Yeah. Yeah, it's pretty big. It's bigger than the CPS.
Is there any reason why a survey like that couldn't be much bigger? I mean, you're doing it on the web.
They send it out to over 1 million, right? So it's
they have a little selection bias problem.
Yeah. Well, that's what the weights are for, Pat.
So it's really a question of response rate. Is that right?
It is a response rate. Yeah. So that's right. Yeah. And then so they do, they construct weights to try to, address these non-response bias for sure. Yeah. But that's part of the reason why I wanted to do it. I did a careful look at the demographics between the two surveys to see if there are kind of major differences, and there just weren't. Yeah.
Of course, the demographics are exactly what they're waiting on. So
Correct.
there shouldn't be, given that they're, using weights, there shouldn't be huge differences in the demographics. What you worry
Yeah,
about,
but they're not necessarily going to slice all the demographics that I sliced.
that's true.
So, yeah.
But what you worry about is that there may be unobserved differences
course.
that aren't in the things
Yeah.
that they are weighting. That's
Yeah.
so.
Definitely.
Do they weight by things like urban versus rural and stuff like that?
If they do, I don't know, because they don't release in the survey whether or not you live in an urban or rural place. So, so I'm not, to the best of my knowledge, they don't directly ask that, but presumably they have the master address file, obviously, so they could
figure it out.
They could figure that out, but I don't know.
Have you looked at whether food insecurity is a function of where you live to any extent?
Yeah, in the CPS, it's higher in technically we don't know rural, urban, it's metro, non-metro.
Right.
Right. It is higher in non-metro areas than metro, but once you condition on income and other demographics, there's really not a rural urban gradient. Now, again, I have to use that cautiously because could there be a really small rural gap that we just don't identify in the CPS? It's possible, right? We just know metro, non-metro. Yeah.
I've got some questions here from the audience. I might want to go to those. Kat Brady had a question about survey methodology, what is being used to conduct the food insecurity surveys. I think you've spoken to that. I don't know if you have anything else you'd like to say, or maybe Kat could elaborate on that question in the box. So I'll let you think about that and then go on to the other question, which comes from an anonymous attendee. Asks, you mentioned that the pulse survey is administered for adults 18 and over, but the HPS asks about food sufficiency at the household level. Could you clarify what level your estimates are and how you compare that to the CPS, which is at the household level?
Yeah. So both surveys are asking about food insufficiency in the household, and you could be younger than 18. If you could be the primary, you could be 17 and the respondent, the CPS, for example. And the pulse, it's 18 and over. Importantly, the function is the weight. I'm using the individual weight, and so the pulse is representative of the population 18 and over. Okay, and so that's why I'm using the population 18 and over in the CPS as well. Okay, so when I presented the initial food insecurity figures, I was using the entire age distribution in the CPS. But then when I moved to the food insufficiency graphs, where I had both data from the CPS and data from the pulse, I restricted the CPS to those 18 and over only. Okay, so I had a same population across the two surveys. Okay, yeah, good question. Great. Now, in terms of survey methodology for Kat, it's the CPS. It depends on what rotation you're on. If you're in you're in the CPS 4 months, and then you're out for 8 months, and then you're back in for 4 months. And so in your first interview, they tried to do it in person. And then the fifth interview, which is after that 8-month delay, they try to get you in person again. And then in the intervening months, it's by telephone, okay? And then the pulse is strictly done by web-based survey. I mean, the Census Bureau did try additional ways of outreach, but the bulk of the responses are coming through directly from web responses. Okay, I don't know what else you wanted, Kat.
Okay, thanks, Pat. I've got another question of something I really didn't quite understand, which was this business of food preparation time and the thrifty food plan. I just, if you could elaborate for me a little bit as a complete layperson in this area as to how that plays into how what the effect of that is on the plan itself and on the way things are calculated.
Yeah, great. If you don't mind, I'll share my screen again because I had a couple more slides. Okay, so Oh, here's my graph. All right. So if you're curious about how big the SNAP program is, it's a big program. So on the left is in thousands of persons, right? So, 40,000 is really 40 million. Okay. So you read that with the blue line with dots, and then the gray line with triangles is read off the right scale. And that's our real spending in 2012 dollars on the SNAP program. So this is running from 1969 up through 2020. And so, this number 70,000 is really $70 billion. So it's a really big program, right? And so you can see in the Great Recession, it got up to close to $80 billion in inflation adjusted terms. So there was a big reduction, right, with the expansion after the Great Recession, but you can see in 2020, a big increase in SNAP spending in response to the pandemic. Okay, so how is the TFP calculated? So the Thrifty Food Plan has 58 food categories consumed by low-income families. And what they do is they collect average prices paid for each of these 58 categories, and then they construct the average nutrient content of each of these categories. There are constraints. So this is actually a linear programming problem that USDA runs. And the constraints are that the diet has to meet dietary standards in the My Pyramid food guides based on age and gender. Importantly, the cost must be equal to the previous inflation-adjusted Thrifty Food Plan prices. So the last time the TFP was updated was 2006, and that had to be kept in constant terms to 95, and that had to be in constant terms to the prior one. So basically, the TFP is the same in real terms as it was today as the one that Molly Orshansky used back in the early 60s, right? So it's been held constant in real terms over time. And then there's no constraint on time inputs, okay? What they then do is they take these 58 categories, they collapse it by 29 categories that make up what they call the market basket. And then they multiply those categories by an economy scale, an equivalent scale factors to adjust for family size, okay? So kind of the idea of this, model of dietary production is the following. We've got household inputs, we've got money and time, okay? And then other factors would be, prices, direct meal provision, and then we'll have some dietary outcomes, right? Which would be food security and dietary quality. So in constructing the Thrifty Food Plan and considering household inputs, the only thing the USDA considers is the money input. They don't make any consideration of the time input in food production. But some people that know a whole lot more about, diets than myself, right, and the nutrition literature, have taken the TFP and gone back and kind of deconstruct and what the time would be involved to kind of meet, the dietary guidelines to be consistent with the Thrifty Food Plan. And it came out for like a family of four, about 13 hours a week in food production, okay? Not shopping, right, and all that stuff. This is food production. So it's a lot of time, right? It's a lot of time. And so there have been some studies to try to look at, what you might have to do to the TFP to, adequately adjust for this time cost. And so based on the literature in the Brookings Hamilton project proposal, I propose increasing the TFP by 20% to build in, the time costs of food production.
So in other words, to make it possible for people to afford food that does not require the kind of home preparation time that's assumed in it. So the fundamental idea is this is a sort of a 1950s household with a delivery of fresh vegetables and so forth, and which would not necessarily be a bad thing, but would require a full-time homemaker to be preparing meals. Yeah,
that's exactly right. And what's kind of interesting is that when you look at like the American time use, various versions, even when you go back to 1965, which is closer to your 1950s
Right.
household. People weren't spending those hours in the kitchen at that, even back in 1965. So
Yeah, and they certainly aren't now.
I have to make a confession here, because something is haunting me in the background of this presentation, which is a device that goes back to the turn of the previous century called the thermal calorimeter, which I think lies behind this, which is the basis for measuring the nutritional content, or the heat content anyway, of food. And so this is really a lot of calorie counting going on here. Well, the man who invented the thermal calorimeter and started all of this was a scientist at Wesleyan by the name of Wilbur Olin Atwater, whose name still reverberates around the USDA from time to time. And he was my great-grandfather.
Ah,
Wow.
how
That's
interesting.
pretty cool.
On my mother's side.
Uh-huh.
That's fun.
But so I'm still trying to get my mind around what this 2 hours a day of cooking is. Basically, you're cooking very large numbers of pots of beans and things like that, right?
That's right. That's right. Yeah. Yeah.
Uh,
That's exactly right.
so
And,
you'd have to have
because
a diet that's really different from what normal
Right.
Americans eat to actually
Right.
stick to the Thrifty Food Plan.
Sure. But it's also, the whole chicken, right? Because you can't buy rotisserie chicken with SNAP. You actually have to buy the raw chicken and cook it and stuff like that. So, there are, the SNAP benefit is flexible, compared to the WIC program, right? Which has a very limited number of food groups, that you can use the WIC benefit for. SNAP is pretty open, across the typical stuff that you would buy in a grocery. It's just that you can't take advantage of one of the big innovations in modern grocery shopping, at least pre-COVID, right, was the hot food bars and all that kind of stuff, right? So people who are time constrained, think single mother families in particular, right, have to walk right past that hot buffet line, unless they use their own money, right? Which, they can use their own money, but they can't use the SNAP benefit for that type of food.
And the
And they also have to have the facility to do the meal preparation at home.
Correct.
Yeah.
Correct.
Yeah, right.
Correct.
And
Yeah.
if
that's
you're living
exactly
in a shelter or something like that, there's probably no oven, right?
Right.
But,
Yeah.
so so I agree with you. It's not wildly realistic for many families to try and have a budget that's as low as what the Thrifty Food Plan allows for
Right.
food.
Correct.
So,
Yeah. No, I think that's right. Yeah.
I had one quick question going back to the elderly thing. It's interesting to me that food insecurity is by and large lower for the elderly than for the rest of the population. And it occurs to me that's probably because we spend an awful lot on providing food for the elderly, which we don't do for the rest of the population. I mean, if you're not elderly, you're not eligible for things like Meals on Wheels, right?
That's correct. Yeah.
And so
Yeah.
the food insecurity for the elderly is kind of after we've already done a whole bunch of policy intervention. That's
correct. Yeah, that's correct. And actually, if you go into the CPS and look at risk of food insecurity amongst adults 18 and over, and do it by age, right? So you graph food insecurity by age. It's parabolic, right? And so that it peaks around age 45, the risk of food insecurity, and then declines basically monotonically, right? And so some of the work that Craig Gunderson and I have done, focusing on adults 60 and over, is that even controlling for factors like education and income and things like that, you still have a strong age gradient and risk of food insecurity, right? That it still kind of declines sharply in age. Now, we don't really know the exact reasons why, that is. Some of it, that really requires more careful qualitative research, right? Which is stuff that, as an economist, that's not my comparative advantage, right? but I'm a big fan of good qualitative research, and this is an area that's still in need of more qualitative research. And that's this strong age gradient in food insecurity amongst older persons. The other thing that was interesting in our work is that even controlling for income and race and family structure and things like that, there still remained a really strong, elevated risk of food insecurity amongst Black Americans compared to white Americans. And I'm a labor economist by training. And, if you look at, trying to look at, say, Black-white differences in earnings or wages, right? That once you layer on all the different demographics, condition on types of industry and occupation and education and things like that, you can, explain away a lot of the racial wage gap, not all of it, right? But a lot of it. And it seems like we can't explain as much away of the racial food insecurity gap amongst older Americans is what we can say with the typical wage, racial wage gap explanation. And again, that requires, I think, further qualitative research to try to understand what's going on there.
Something like the extent to which there are community resources supporting the elderly, things like senior centers, which are probably more likely in higher income areas.
Indeed they are. And in fact, some of my collaborators on this at the National Foundation to End Senior Hunger, they've done a lot of work interacting with senior centers around the country. And most of the people that go to senior centers are middle class or higher, and so,
There's a question or a comment in the chat that I would like just to relay to you for your reaction from Paula Brayton, who writes, one thing we should be mindful of is that the rise in processed convenient food has tracked remarkably well with our diabesity epidemic. It would seem prudent to focus on learning how to cook real foods in a time-efficient manner.
Yeah, that's a great point, and it is something that we should remain mindful of. I would actually, I like to argue in favor of the basic structure of the SNAP program because it does maintain a lot of consumer sovereignty. While it is devoted to food and purchases, so it's not the same as cash, right? It's not 100% fungible, but it's for food. But you do, have a lot of flexibility in the types of foods that you can buy. So it's culturally sensitive in that regard, right? So you're not actually just giving people baskets of food. There was a proposal early in the Trump administration to basically cash out SNAP and send people food boxes instead. And, that didn't get much traction, which you shouldn't be surprised. But one of the costs of that is that, it takes a lot of consumer sovereignty away. And and thus, is not nearly as culturally sensitive as what I think the SNAP program is. The types of food, consumed by, the demographic composition of people in the state of Texas is a lot different than the demographic composition of the people in the state of, Kentucky or Ohio or Michigan. So, the fact that SNAP is flexible in that regard is a good thing. There is actually some research trying to identify the causal effect of, or at least the links between SNAP and obesity, because certainly there are people that have noticed that, obesity's gone up as SNAP participation's gone up. Does SNAP cause obesity and things like that? And there's not a lot of great causal work. There are correlations. The correlations are positive. We got to be honest with ourselves. The correlations are positive. Now, when people try to do causal identification of the links between obesity and SNAP, they tend to find nothing, or they just have really hard time trying to identify a causal pathway. So that does remain kind of an open question, whether or not there's a causal link. There's some really interesting work done by, I'm going to draw a blank on her name. Senior moment here. It'll come to me. She's MD at University of San Francisco, and this is I hate it when this happens.
It happens all
She's
the
a
time.
friend. She's a friend. You know, forgetting friends' names. It'll come to me. So she's done some really neat clinical work.
Siegelman?
Hillary Seligman. Yes. Yeah.
That's Seligman coming from the chat, or I relay it.
Yeah. Thank you.
Yep.
Thank you, Lauren. Yes. Yeah, sorry. I should never forget Hillary's name. She's great. So she's done some really neat clinical work. And what her work shows is that, you know, the SNAP benefit for the typical majority of households runs out in about 2 or 3 weeks. It doesn't carry them the full month. And so what you see in the clinic is admissions into the clinic at the end of the SNAP benefit month associated with people who are diabetic. So hypoglycemic episodes and things like that. And so what you see is, you know, people are, you know, suffering from, you know, inadequate nutrition that's kind of continuous over the benefit month. This, of course, would be another advantage, Jamie, to a higher SNAP benefit, is that in theory, it should carry the person further in the benefit month.
Right.
What's, you know, kind of important to remember is that these individuals that face, you know, these food hardships, you know, some of this work by Sundal Mulanathan and others on, you know, behavioral stuff is on scarcity, right? That oftentimes what happens is that if people are uncertain about their next, you know, meal, then they tend to hoard and kind of overconsume, and that has implications for your weight as well, right? And you also want to go for quick bursts of calories, right? And so that can have implications. So it may not be SNAP per se, right? But it could be some of the underlying family, you know, economic conditions, or even your underlying health conditions that kind of feed into this potential link between food assistance and obesity.
Yeah. Actually, we find a link between income and obesity in the first place, right? I mean, obesity is more common in the low income population. And so it doesn't have to be the food assistance is obviously correlated with income as well. So it could be simply that they're both linked to conditions that are common in the low income population. Right.
And in fact, it's even worse in the low income. I mean, really, if you look at the healthy eating index, Americans really don't start, and it's a scale that goes from 0 to 100, and 100 is good, and you know, less than 100 is bad. So, but basically, you know, I think the average American's around 55 on the healthy eating index, and it's not until you reach over $100,000 in household income that you really start moving up, you know, an increase in food diet quality. So it's really kind of the middle class and below, right? That you know, diets are a challenge in this country. Yeah.
Well, I think we're pretty much at the time, Pat. If we usually keep this to 1 hour, we could go on for quite some time. It's been a really fascinating discussion, and I want to thank you. But I also want to say thank the audience and say on behalf of those of us who are Texans, if you're looking for food quality, this is the right state to be in. It really, I've been here now for 36 years, and I think it probably can't be beat.
Well, hopefully someday I'll get to Austin. I've never been, and I would have loved to have been able to do this in person, but so maybe someday in the future.
Maybe next year.
That's right. All right.
Thank you very, very much.
All right. Thank you. Bye-bye.